Now, managers of facilities under probe for receiving fraudulent payments from the National Health Insurance Fund were hard-pressed to come clean on their dealings. Appearing before the Dr. Robert Pukose-led Departmental Committee on Health, they were questioned on inconsistencies in medical records and equipment of the facilities, faking bed capacity, and breaching contracts with NHIF in order to claim money from the insurer. Ayub Abdikadir has more.
In a sitting that heard from managers of the facilities under probe, some suspended following a directive by Health CS Susan Nakhumicha, and subsequent investigation of all the hospitals involved by the Kenya Medical Practitioners and Dentists Council of embezzlement of billions of shillings from the national insurer NHIF. The Health Committee was told that in many instances, the registration of hospitals was done without due diligence and that there were cases of medical negligence and some discharge records that did not match admission registers.
You admitted, it's on record, that it is true you use wrong codes. And when you use wrong codes to make a claim, then it means you are falsifying documents. And when you falsify documents, it amounts to fraud.
Yeah, we've not had complaints before from the NHIF.
But you've just admitted that they were wrong. You used wrong codes to make claims.
As a clerical error, Honorable Chair.
But now that you use wrong codes, did you refund that money to NHIF?
I do not know, Honorable Chair.
An audit by NHIF relating to payments made to the facilities including Afya Bora Hospital Annex, Afya Bora Hospital, St. Peter's Orthopedic and Surgical Specialist Center, Jakim Medical Center, and Jakim Hospital Nkubu Limited. The committee established that the facilities claimed payments before the requests could be approved by NHIF.
And is there then a provision for when the exception to the rule of thumb comes into play?
We are supposed to write a report, and I've written the report. I think it will be fraudulent if somebody will say the dates of admission are not matching with the date of admission in the system, and the patient is inexistent, or you did not offer the service. But I offered the service.
In some instances, the committee pointed out mismatch in the records of patients, special admissions to theatres and breach of contracts the facilities had with NHIF.
An omission in the recording of the patients' names in theatre register and procedures performed not in the contract. What is your response to that?
I wish if you would allow me to forward that question to the claims person who answer better.
But you can confirm that it was done?
Yeah, it was done.
Take patients to theatre without having the consent either of the patient or of the relatives. Then what happened to that patient? With whose consent are you doing the operations?
Consent.
Yes.
I'm the one who reminded you to take consent.
Chair, it's a human error in terms of talking. I had so much in my mind.
Chair, in its audit report, NHIF listed claims amounting to millions of shillings done before pre-authorization approval, cases of doctors whose credentials were missing from KMPDC register, falsifying bed capacity, unfairing of patients from far-flung regions, and allegations of patients' inducement. The Departmental Committee will on Thursday and Friday hear from the Kenya Medical Practitioners and Dentists Council, KMPDC, on the registration of facilities and the NHIF board on how money was lost from the public coffers. The chilling accounts of hospital administrators before the National Assembly's Departmental Committee on Health lifts the lid on systemic fraud, medical negligence for material gain, and the grim reality of corruption. It is, however, unclear how the country's unhealthy healthcare system that has been gradually deteriorating will find a fine footing. Ayub Abdikadir, Citizen TV, Parliament.